Hi, this is Dr. Crystal Whistler. Thank you for joining me today on this video. We're going to discuss functional lab testing. So to many of you, functional medicine and functional lab testing are new concepts. So I really want you to understand them so you can see the value that it brings in unraveling the mysteries of your case. The first question that most people ask is, what is functional lab testing? Now, the easiest way to understand this is to understand what current diagnostic testing looks like. For example, when a patient gets an MRI, what we're looking for are gross anatomical changes. This means we're looking for changes on a very particular scale because there has to be significant damage for it to even show up. A good example is a patient suffering from MS-like symptoms. They may present to a neurologist and be directed to get an MRI, but it takes about 60% of the neural sheath to be damaged before it shows up on an MRI. Therefore, the symptoms might be present with no clear diagnosis. So the patient is told that everything is normal and that they continue down this path until their symptoms get worse because the actual destruction has not been bad enough for the doctor to see it on the MRI. So functional lab testing, on the other hand, instead of looking for gross anatomical changes such as an MRI or colonoscopy or a study of that nature, looks for changes on the cellular level. The cells are what drive our physiology. The cells are where every basic function in our body takes place. In order for our cells to be healthy, we have to have healthy mitochondria and energy production. The good thing about functional lab testing is that we get down to the nitty-gritty details of your biochemistry. When we alter your physiology and your biochemistry, we start seeing some amazing results and amazing changes that take place in your global health. So no matter what the condition that you have is, every single person on the planet needs good cell function. And because we focus on that so heavily in our practice and with our method, we get outstanding results for our patients. What mechanisms can we test is another question that comes up quite often. You first have to understand that our body systems work like gears. So when one gear turns, all of them are impacted in some way. So therefore, it's important to look at your body as a network of systems, not just individual parts. So our traditional medical model may do this at times because it's so fragmented in its very nature. But now this is good when you have a specialty disease. But most people today, they're suffering from chronic illnesses, and these chronic illnesses require a more global approach instead of a single organ approach. So with functional lab testing, we can test things like energy production, which occurs in the mitochondria. We can measure detoxification and oxidation. We can measure brain health and methylation factors. We can look at digestive health. We can identify stress and inflammatory issues. We can take a deeper look at endocrine health, which also refers to hormone health. Immune health is another area that we can focus on. And mechanisms like leaky gut can also be tested, and more importantly, quantified. So the benefit of measuring a process and being able to remeasure is quite profound. It gives us a better diagnostic criteria and better evaluation of the treatment that we're providing. So we can see if what we're doing is actually working, not just by relying on the patient's symptoms, but also relying on their physiology and the lab testing. Now you might notice that many of the pillars that we place great emphasis on are covered in the lab testing. Energy production, detoxification, brain health, digestive health, stress and inflammation, and then of course we evaluate lifestyle and environment through our intake process and patient education. So we can cover all of these pillars with a good history and good lab testing. It's also very important to understand how disease progresses over time. Many diseases have prolonged dormant periods. So what this means is disease is developing silently in the background and hasn't manifested itself to either get to the point of having symptoms or get to the point where there's enough degeneration and damage that it can be detected on lab testing. By doing functional lab testing, we can identify physiological imbalances that may lead to diseases over several decades. We can catch many diseases before they develop into symptomatic stage because that symptomatic stage is much later in the progression. So take heart disease, for example. A person develops heart disease over the course of their lifetime. Maybe that's 50 or 60 years. In about half of those patients, their first heart attack is their first symptom. They had no idea that they had a problem brewing for all these years. So we can't always rely on symptoms, and we can't always wait for degeneration to show up before we do something about our health. So what I'd like to do now is review some of the lab testing that we commonly do with our patients. There's dozens of tests that we can choose from. Our job is to provide the testing that corresponds with the patient's presentation. These are 3 of the tests that we use most commonly, and I wanted to share those with you on this video. One of our most popular tests is the urinary organic acids test. This test is done through a single urine sample collection first thing in the morning. As I go through this, I'll quickly go through some of the highlights of this test and help you understand why we prescribe this test the most to our patients. The first page is a summary, and it gives us insights into where the problem areas of the patient's physiology might be. For example, you can see this patient has issues with fat metabolism, energy production, as well as transmitter function, indicating high stress levels. But more importantly, they have issues with detoxification, and also we see they've got imbalances in their yeast and fungal markers. So we get a nice summary that highlights the areas that we need to focus on. As you go through this report, we get to look at some of the sections of the report and understand where the breakdowns might be taking place. So this gives us some insight into how we can further support the patient through nutrition. Each of the pathways that are being tested are enzyme cofactors and vitamin and mineral driven. So what this means is that we can identify a certain buildup of a particular marker, and this indicates to us that a certain pathway is not working adequately, indicating which cofactors and vitamins may help support proper metabolism through this pathway. On this page, you can see the B vitamin status. You can see methylation cofactors, and you can see the neurotransmitter health and oxidative stress. So oxidative stress markers are very important because these can be predictive in patients who have a high risk for cancer or patients who have concerned about adequate detoxification. The next section looks at detoxification indicators, and we also see compounds of bacterial imbalances, yeast, and fungal overgrowth. So we get some amazing insight into the patient's energy production, into the patient's detoxification and oxidation, and into the patient's brain health and methylation, as well as a sneak peek into their small intestines that helps us determine if they have a bacterial overgrowth going on. This last page of this report indicates to us what nutrient levels a patient can be supported with to adequately replenish and provide requirements for them to get healthy. So we can use this information to generate a customized program for a patient, also a custom compound or formula based upon these recommendations. The nice thing about this test is that it's very easy. So it's affordable, and it gives us amazing insights into 4 of your critical pillars of the 6 that we evaluate. Another important test that we run in our practice on many of our patients is a comprehensive stool analysis. Several labs have a comprehensive stool analysis, and we use different labs based upon the markers or based upon what we're looking for. So this is an example of doctor's data comprehensive stool analysis with parasitology. So we get from this test is a sneak peek into digestive function. We get to look at the type of flora that are predominant in the gut. We also get to identify if there's yeast overgrowth through culture, but also microscopic analysis. And we get to determine if there are any ova or parasite overgrowth that's taking place. Also, we get insights into digestion and absorption, so we can determine if a patient is adequately digesting and absorbing nutrients from their food. The next section looks at inflammation. Inflammation is very critical, especially in the bowel, because this could be a hidden source of chronic inflammation for many people and be a driver to many other health problems. We also get to look at immunology. Your immune system is predominantly found in the digestive tract. In fact, 80% of it is found in the digestive tract. So we want to have a robust immune system in our gut in order to have systemic health in our body. The last section of this report looks at short-chain fatty acids, and this gives us an indication of the environment and the terrain of your gut health. This is very important, helping us determine if your gut can harbor healthy bacteria or not. And then your traditional markers like red blood cells, pH, and occult blood are indicated on this test. The nice thing about this test is it gives us additional information for which antibiotics and which natural agents might be most beneficial if the patient has bacterial overgrowth or dysbiosis. With this test, we get amazing insights into the digestive function, not just doing a colonoscopy. So doing a colonoscopy doesn't tell us anything about the digestive system is functioning. It only tells us if the digestive system has an overt disease process going on. So this tells us about function, and it gives us amazing insight into how we can support the patient's digestion and optimize it. Another test we do quite often on our patients is a hormone metabolite assessment. So this test gives us information about hormone metabolism, and it helps us to identify if our patients have hormonal imbalances. By taking a deeper look at hormone health, we can help assess if our patients' communication systems are actually working properly. The nice thing about this test is that it's done by urine, and when you're looking at urinary metabolites of hormones, we get to also assess if the hormones are being eliminated from the body. For example, estrogen in high amounts circulating in the blood can create a lot of health problems and can lead to an increased risk of cancer. So through this test, we can identify if a patient is adequately eliminating these estrogens and not putting themselves at unnecessary risk. This same test also assesses adrenal function, and it helps us to map out your adrenal rhythm. Your adrenal hormones are circadian, which means they're made in different amounts at different times during the day, particularly cortisol. So by looking at your circadian rhythm, we can identify if your sleep and wake cycle has been regulated properly. We can also identify is there a stress or inflammatory process going on, and we can see the state of your adrenal health. So your adrenal health is critical to healing and repair, and without healthy adrenals, it is very difficult for other hormones in your body to be balanced as well. So this is a critical test. We pay a lot of attention to this test because it gives us profound insight into your communication system in your body. So what I'd like to do now is highlight the benefits of functional lab testing. So the first one is tremendous cost savings over diagnostic testing. Typically, an MRI can cost several hundred to several $1,000s depending on the nature of the study, but provides little insight into why this disease process, if identified, is even taking place. So by doing functional testing, we can identify disease processes much earlier, before they are detected by these type of diagnostic studies such as an MRI or CT scan, and we can get insights into why the imbalances are taking place and work on correcting it. Secondly, we can detect physiological patterns long before disease develops. Third, we have objective data that we can remeasure periodically. So this allows us to measure if the treatment that's being applied and the lifestyle changes that the patient is making are actually working or not. Number 4, we can identify deeper layers of the problem. So if we can identify biochemical imbalances or metabolic imbalances at the cellular level, this gives us great insight into the problem. Number 5, the testing is done at home, which provides for additional convenience if it's a urine, saliva, or stool test. So some blood testing can be done by a blood spot. Other blood testing might require going to the lab and having your blood drawn. Number 6, our program allows you to have direct-to-client pricing. So this can save up to 80% in some cases off the retail cost of testing. Number 7, we provide a detailed interpretation of the lab findings in a video format. So this allows you to view the results to gain more insight and understand what the results are telling you. We can then further discuss the results with you when you come and sit down for your appointment, but at least you have a working understanding of what your lab results are telling you. And last but not least, functional lab testing provides new data points to uncover new opportunities. So what I mean by this is getting new data points regarding your health. You can then take further action. So if you've been told there's nothing that can be done for you, a functional lab test almost never comes back normal in my practice. So this shows us opportunities and identifies how you can be helped. It identifies how you can support your body at a very fundamental level, at the level of the cell, at the level of your biochemistry. And what you will see unfold is amazing health outcomes. So we see this over and over with our patients, and that's why we're so passionate about sharing this information with you and giving you the opportunity to take advantage of looking at your health from a different perspective and providing you with new opportunities to heal and feel the best that you can. So I hope this video was helpful, and I look forward to seeing you in the future. Thank you.